Hello everyone, we are now going to go over the flow cytometry plots from a lymph node from a 68-year-old man who presents with diffuse lymphadenopathy. So this is a lymph node specimen. So we expect majority of our cells to be in the lymphocyte gate. And here in CD45 versus site scatter, we see a population in the lymphocyte gate that kind of goes that has a variable site scatter that goes into the monocyte gate and goes even beyond. So we have cells with high site scatter here that express bright CD45. So these are this indicates that these are larger lymphocytes. Now let's see what these express phenotypically. In CD20 versus CD10, we see that majority of the cells that we see in the lymphocyte gate are B cells, and majority of our B cells express CD10. So these are a CD10 positive large B cells. And these are negative for CD34, so they don't express the immaturity marker CD34. They are expressing surface light chains, and they are expressing kappa. They're negative for lambda, so this is a kappa restricted CD10 positive large B cell population. And they also express CD71. So CD71 is usually positive on the germinal center B cells. So this is a germinal center B cell neoplasm arising from the germinal center. So it's positive for CD10 and CD71. Now, in the second tube, we again see that these cells have high site scatter, and the CD19 positive cells are painted maroon here. Those are the B cells. The 5 positive, 90 negative cells are the T cells, and these B cells do not express CD23. They are negative for CD5. And again, here we see that they are kappa restricted. They're positive for FMC7, and they're positive for CD200. Now, one thing that we can see in this is they are negative for CD5 and CD23. CD5 can be rarely positive in large B-cell lymphomas. The one that can be positive is mantle cell lymphoma that presents with blastoid or pleomorphic morphology, but that would be negative for CD10. This is a CD10 positive B-cell lymphoma. So those like high-grade follicular lymphomas or diffuse large B-cell lymphoma can rarely present with CD5 expression, and those are associated with poor prognosis. But here our neoplastic cells are negative for CD5. CD23, its utility is usually to look for follicular dendritic cell markers, but sometimes diffuse large B-cell lymphoma or follicular lymphoma high grade, the neoplastic cells themselves can express CD23. So it might be difficult sometimes to interpret that from IHC, and flow cytometry helps in that regard. So here we see that our neoplastic cells are negative for CD23 also. So, these cells are negative for 103, and they're positive for, partially positive for CD38. So CD38 and CD21 are usually positive on the germinal center B cells, which is why here also we see that these are positive. So here we have a neoplasm arising from from the germinal center. So you can just say, in your top line for the flow cytometry report, you can say B-cell lymphoma of follicular center origin, you can say that, or you can say CD10 positive B-cell lymphoma, and in your comment you can say these cells have very high site scatter, suggesting that these are large cells, and the differential diagnosis includes high-grade follicular lymphoma or diffuse large B-cell lymphoma, germinal center origin, or it could be a Burkitt's lymphoma. So you can discuss all that in your differential diagnosis. Do not top line this as either follicular lymphoma or diffuse large B-cell lymphoma, because that's a tissue diagnosis. Even if a patient has a history of diffuse large B-cell lymphoma, there is still a chance that a lymph node biopsy subsequently from some other site is showing high-grade follicular lymphomas. We have seen that in practice. So do not say that, the subtype of the lymphoma on your top line for cases like this. Thank you.